that has to do with what you mentioned, that here in Brazil, we don't have to do a residency, contrary, for example, to the United States. And I was completely unaware of how things worked in Italy. But the residency in the United States, for example, surgical residencies are 5 years long. So you have almost a new med school to hone your craft, be it surgical or clinical, and gather a lot more experience. Are you aware how long is residency in Italy? Do you have any idea how it works there?
I believe I was in surgery there, and they told me that it was 5 years surgery, but it varies from residency to residency. And what I thought was very interesting is for example, I was in general surgery. That's the one that I was in. But they have, for example, plastic surgery or, you know, all the other types of surgery. And you have to choose at the very beginning of your residency. It's not like in Brazil that you choose, for example, I'm going to do general surgery, and then after 3 years of general surgery, I will choose my subspecialty, kind of. In Italy, you choose at the very beginning. So I think this was very interesting. And I believe plastics is 5 years as well, but you know at the very beginning how many years you're going to do and which surgical specialty you're going to choose. You have to choose at the very beginning. It's not like in Brazil that you do general surgery and then you get to choose. I think I don't like this way because I'm a very indecisive person. So I would be very like, oh my God, I have to decide right now. And then what if I change my mind? But yeah, very interesting. And this is how it works there, at least for surgery, for example. That's the one I had more contact with.
The truth is, I think this is a complete mess. And I'm not saying I have a moral objection to it, I just think it's messy. I'm not saying it's wrong. But I think we
Yeah.
have pretty much all these different strategies in all countries. Here in
Yeah.
Brazil, we have both styles of subspecialties versus fellowships, even though we don't call them fellowships, and just going straight into a program. For example, we recently had that with cardiac surgery. Neurosurgery
Mm-hmm.
is a different specialty from general surgery. If you're going, for
Mm-hmm.
example, into urology, you take general surgery first and then
Yeah.
urology. But neurosurgery, I think, has always been a separate residency, a different one from general surgery. So you go
Yeah.
straight into neurosurgery. And I think it's been like 5 years that cardiac surgery has been transitioning as well. So now you apply to cardiac surgery, and it's like, I don't know, 4 or 5 years, rather than going first into general surgery and then cardiac surgery. So it's changed.
Yeah.
And we have both. And as far as I'm aware, in the United States, it's even worse because they have different programs with different strategies. So if you're going, for example, into plastic surgery or cardiothoracic surgery, you will have programs that have direct access. You just apply for plastic surgeries 5 years, or you have other programs that are fellowships. So you have to have general surgery. It's like I said, I'm not morally objected to it. I think this is wrong. No, I don't. I
Yeah.
just think it's a messy situation. It's
Yeah. Yeah.
hard to
But
even comprehend what's going on.
yeah, I think Brazil is kind of messy too. You know what I mean? Because we also have many possibilities. You can you can, for example, do this is the one I think is a good example. You can do hand surgery if you are a plastic surgeon. You could do hand surgery if you're a plastic surgeon. And I think this is it, for example. But it's a particularity. It's kind of like it's something that you will only know if you are in touch with, those specialties. So knowing what you can do depending on which specialty you can work at is kind of messy. Another example is blepharoplasty. Plastic surgeons can do it. Ophthalmologists can do it. And I think dermatologists can do it also. Depending on the training that you do, you can do many things. So I think in a way, everything is messy. And you will only get to know what you can do if you are particularly inserted in that specific area. Because it's very messy. You can, for example, finish your orthopedics residency and then do hand surgery, or finish your plastics residency and then do hand surgery. You know, it's so weird. It's so, it's so messy, as you said. But I think it happens with every country, not just Italy.
I have two more examples to your list. You have head and neck surgery, which could be from otolaryngology or from general surgery. And you have critical care, which could be either a clinician, someone from internal medicine, or a general surgeon, or an anesthesiologist. You could have either of the three specialties.
Wow, I didn't know about that one. You know what I mean? So you will only know those things if you are particularly inserted in those areas. So in a way, I think everything is very messy. Medicine is messy. It's like, this is something that I say all the time. I thought, as a medical student, starting off medical school, when I made the decision to, start on this path and everything, I was like, oh, nice. I decided to be a medical doctor and my path is chosen. I chose to be a medical doctor, and then I don't have to worry about choosing again. And I hate choosing, as I said. I hate choosing because I'm an indecisive person, and I love a lot of things. I have a lot of interests. I'm a very, I'm a very interested person in a lot of, subjects and situations. And anyways, so then I was like, I have it all figured out. I'm going to be a medical doctor. And then I got into medical school and I was like, shoot, now I have to choose again. And there are basically 100 paths that you can take when you get into medical school. So, yeah, it's confusing. Medicine is very confusing.
And you have inadvertently, to your own demise, brought up a topic I cannot skip over. Because Stephanie loves to make some suspense on her Instagram. I'm not sure whether she has ever said which specialties she intends to go into, but
Yeah.
going to ask now. So, have you chosen your specialty yet?
No, I haven't decided completely, but I'm going to give you some hints. I basically want something that can be related to lifestyle in a way because I love this topic in general. I think that balance and having, working with preventive medicine is more like me. And it took me some time to figure out this characteristic that I have, to know myself a little bit better, because I did think that I was the type of doctor that would love to just treat something that was wrong. And then recently I have been working on getting to know myself a little bit better and figuring out that I like more the aspect of preventing disease from happening. So I'm thinking about something related to that in a way. So something that can prevent disease rather than curing disease after it is present. And I do have some areas on my mind, but I haven't decided completely, especially because I will work for a year and a half. So I'm not taking the tests this year. For those of you guys who don't know, in Brazil, we have residency tests at the end of the year, at the end and beginning of the next year. So kind of like December, January, right? So December, maybe some start in November. So I would say, for example, from November to February is when the tests take place. And you basically have to choose the universities, the hospitals that you want to take the tests at. and then you go in person and take those tests. And this is very different from country to country. In the US, it's a completely different process. For example, it's so different. You have the matching process. It's not a specific test. It's a bunch of tests that you take. They take into account your resume, your clerkship and observership experiences. In Brazil, it's not so much like that. In some programs, they do take your resume into account, but basically it's more about the tests that you take. Anyways, so I'm not planning to take the tests this year because, first of all, I haven't decided. Second of all, I'm getting married at the beginning of next year. Yay. So this situation, thank you. This situation also is something that I want to be involved in. Like, I want to be involved in planning the wedding and doing things like that. So I don't want to be like involved with residency at the beginning of the year yet. And also because I want to work and see the scenario that I like to work more at. If I like more the hospital, if I like what I like the most. Because even though during medical school we did have some experiences, we definitely don't have all the experiences that we can have. And so I think that working is fundamental, in my opinion, right? To have some experience and know what you like, right? So I will work for 1.5 years. So I'm graduating now in July. So I have 6 more months until the end of the year, and I have the whole next year to work. And also another reason is because I want to work to make some money, to go into residency, because we don't get a lot of money as residents here in Brazil. I think in general, residents don't get a lot of money. So I do want to save up some money, during the year to basically live better as a resident later on. So yeah, I think those hints are enough for you to think about some areas. But I'm more involved with, right now, I think I will be more involved with, preventive medicine in a way.